Hey guys, this is Fixer Med. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 41 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at external hemorrhoids. Definition. Hemorrhoids are masses that typically protrude from the anus during defecation. Common associations: constipation, prolonged sitting, straining during bowel movements, pregnancy, and conditions that impede venous return. External hemorrhoids, located below the pectinate line, consist of dilated tributaries of the inferior rectal veins, IRV, painful due to somatic innervation by afferent fibers of the inferior rectal nerves. Let's next take a look at internal hemorrhoids. Definition. Internal hemorrhoids are dilated tributaries of the superior rectal veins, SRV, located above the pectinate line. Pain. They are not painful because the mucosa is innervated by visceral afferent fibers. Common associations, frequently develop during pregnancy due to increased pressure on the superior rectal veins. Let's next take a look at perineal pouches, contents of the deep pouch. The deep perineal pouch is formed by the fascia and muscles of the urogenital diaphragm. It contains sphincter urethrae muscle, deep transverse perineal muscle, bulbourethral, Cowper's glands, in males only. Ducts perforate the perineal membrane and enter the bulbar urethra. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 50-year-old man presents to the clinic with a complaint of pain and swelling around his anus, especially during and after bowel movements. He describes the pain as sharp and severe, and he occasionally notices a small lump that protrudes when he strains on the toilet. He has a history of chronic constipation and spends extended periods sitting due to his desk job. On physical examination, you observe a tender bluish mass at the anal verge. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The incorrect choices can be explained as follows. A. Anal fissure is incorrect because although it causes severe pain during defecation, it typically presents with a linear tear in the anal mucosa, not a protruding bluish mass. B. Internal hemorrhoids is incorrect because internal hemorrhoids are located above the pectinate line and are generally not painful due to their visceral innervation. They also do not typically present with a tender bluish mass visible at the anal verge. D. Perianal abscess is incorrect because a perianal abscess presents as a painful red swollen area due to infection and inflammation, not as a bluish mass. It is usually accompanied by fever and systemic symptoms of infection. E. Rectal prolapse is incorrect because rectal prolapse involves the protrusion of rectal tissue through the anus, presenting as a more substantial mass that involves more extensive rectal mucosa, unlike the localized bluish mass of external hemorrhoids. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Testicular torsion typically presents with sudden, severe pain, often accompanied by nausea and vomiting, and the testicle is usually tender, swollen, and positioned higher in the scrotum. This acute condition is a surgical emergency and does not present as a chronic painless mass. B. Hydrocele involves a fluid-filled sac around the testicle, leading to a painless swelling that transilluminates light. Unlike varicocele, the mass is not affected by the patient's position and does not feel like a bag of worms. D. Epididymitis generally causes acute scrotal pain, swelling, and possibly fever, with the epididymis being tender to touch. This condition is often associated with urinary symptoms and is more painful compared to the typically painless varicocele. E. Inguinal hernia may present with a groin bulge that extends into the scrotum, often reducible, and associated with a history of heavy lifting or straining. The mass from an inguinal hernia does not feel like a bag of worms and may cause discomfort or pain rather than being painless. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old woman presents to the clinic with a complaint of painless rectal bleeding. She notices bright red blood on the toilet paper and sometimes in the toilet bowl after bowel movements. She recently had her first child and reports experiencing constipation postpartum. On examination, there are no external abnormalities, and a digital rectal exam is unremarkable. Endoscopy reveals engorged vascular structures above the pectinate line. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, internal hemorrhoids. Internal hemorrhoids are dilated tributaries of the superior rectal veins above the pectinate line, often presenting with painless rectal bleeding. This condition is common postpartum due to increased pressure and straining from constipation. The patient's symptoms of bright red blood and the findings on endoscopy of vascular structures above the pectinate line are consistent with internal hemorrhoids. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Anal fissure is incorrect because an anal fissure typically causes severe pain during defecation and is associated with a visible tear in the anal mucosa, which was not observed in this case. B. Colorectal cancer is incorrect because while colorectal cancer can cause rectal bleeding, it usually presents with additional symptoms such as changes in bowel habits, weight loss, and may show more advanced abnormalities on physical examination and endoscopy. C. Diverticulosis is incorrect because it typically presents with painless rectal bleeding, but is associated with outpouchings in the colon, which would not be identified via endoscopy and does not fit the patient's history of postpartum constipation. E. Ulcerative colitis is incorrect because ulcerative colitis presents with diffuse inflammation and ulceration of the colon, often causing chronic diarrhea, abdominal pain, and systemic symptoms. The isolated finding of painless rectal bleeding with normal digital rectal exam and endoscopy above the pectinate line is more consistent with internal hemorrhoids. All right, now that we have covered this question, let's move on to look at the next question. A 30-year-old male presents to the emergency department with pain and swelling in the perineal region following a fall from a bicycle. He reports difficulty urinating and a sense of fullness in the perineum. On physical examination, there is tenderness and swelling in the deep perineal pouch. Which structure is most likely injured in this region? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A, bulbourethral, Cowper's glands. The deep perineal pouch contains the sphincter urethrae muscle, deep transverse perineal muscle, and the bulbourethral glands in males. Given the patient's symptoms of perineal pain, swelling, and difficulty urinating following trauma, the bulbourethral glands, which are part of the deep perineal pouch, are likely involved. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B. Ischiocavernosus muscle is incorrect because this muscle is located in the superficial perineal pouch and is involved in the erection of the penis by compressing the crura. C. Superficial transverse perineal muscle is incorrect because it is also located in the superficial perineal pouch and stabilizes the perineal body. D. External anal sphincter is incorrect because it is located around the anal canal, not in the deep perineal pouch, and is responsible for controlling defecation. E. Dardos muscle is incorrect because this muscle is part of the scrotal wall and functions to regulate the temperature of the testes, not part of the deep perineal pouch. D. Above the pectinate line, inferior rectal vein into the portal system. Below the pectinate line, superior rectal vein into the inferior vena cava is incorrect because the inferior rectal vein drains below the pectinate line into the inferior vena cava, and the superior rectal vein drains above the pectinate line into the portal system. E. Above the pectinate line, superior rectal vein into the inferior vena cava. Below the pectinate line, inferior rectal vein into the portal system is incorrect because the superior rectal vein drains into the portal system, not the inferior vena cava, and the inferior rectal vein drains into the inferior vena cava, not the portal system. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.